Hello, my name is Dr. Dimitrios Nasioudis. On behalf of my co-authors from the University of Pennsylvania, I'd like to thank you for the opportunity to present and summarize our study titled Impact of Adjuvant Chemotherapy on the Overall Survival of Patients with Advanced Stage Low-Grade Serous Ovarian Carcinoma. Low-grade serous ovarian carcinoma represents approximately 5% of all epithelial ovarian tumors. It is relatively chemoresistant to standard platinum-based chemotherapy, and the impact of adjuvant chemotherapy for patients with advanced stage disease following cytoreductive surgery is not well established. We accessed the National Cancer Database and identified patients diagnosed with stage 2 to 4 low-grade serous ovarian carcinoma who underwent primary cytoreductive surgery and had no data on the administration of adjuvant chemotherapy and the outcome of their cytoreductive surgery. We excluded patients who received neoadjuvant chemotherapy, those with unknown residual disease status, as well as those who received chemotherapy more than 6 months from their surgery. We identified a total of 618 patients, and 501 received adjuvant chemotherapy. In the present cohort, anti-estrogen hormonal therapy was rarely administered, while the median follow-up was 47.9 months. There was no difference in overall survival between patients who did and did not receive adjuvant chemotherapy. 4-year overall survival rates were 77.5% and 76.1% respectively. After controlling for confounders, again, administration of adjuvant chemotherapy was not associated with better overall survival. However, patients with gross residual disease had worse overall survival compared to those who had complete gross resection, with a median overall survival of 69.8 months versus 90.3 months respectively. Again, after controlling for confounders, presence of gross residual disease was associated with worse overall survival. Interestingly, following stratification by residual disease status, adjuvant chemotherapy was not associated with an overall survival benefit for patients who achieved CGR or those who had gross residual disease. In conclusion, in the present cohort, approximately 1 in 5 patients with advanced stage low-grade serous ovarian carcinoma did not receive adjuvant chemotherapy following primary debulking surgery. Residual disease was once again identified as an important prognostic factor. However, adjuvant chemotherapy may not be associated with a survival benefit in this patient population.